In this video tutorial, I'll demonstrate the cardinal application techniques and movements used in both radial and focused shockwave therapy. These modules are also available in Sandra Hagen Ansert's textbook of Diagnostic Sonography, 9th edition, linked below.
Medical shockwave therapy is a non-invasive procedure that employs high-energy, low-intensity sound waves to elicit a cellular response. Shockwave therapy principally requires a slow, deliberate delivery of energy into a target tissue to initiate a regenerative or degenerative response.
Let's start with the difference between focal and global shockwave application techniques. Focal applications are static, focused on concentrated energy delivery to a single target tissue. Providers often cradle the outer edge of the transmitter tip between the thumb and index fingers for targeted treatment. Examples of focal shockwave application: insertion of the Achilles tendon, trigger point therapy. In contrast, global shockwave application technique is dynamic, emphasizing circulation, tissue disruption, or intracorporeal movement. Providers often hold the shockwave applicator by the shaft for optimum control. Global technique examples: plantar fascia, skin tightening. Both shockwave application techniques can be modified by these 5 cardinal transducer movements.
The 5 cardinal movements used during shockwave treatment are: sliding, a smooth back-and-forth movement along a tendon or fascia, ideal for scanning large tissue areas. Tilting, slightly angling the transducer to reach deeper layers or wrap around curved structures. Rotating, circular motions to distribute energy evenly over a treatment zone. Rocking, a continuous lateral movement of the handpiece, slowly oscillating from side to side, is employed to deliver mechanical force over a wider area, centered around specific point of entry. Compression, applying steady downward pressure to maximize penetration at a specific site. Demonstrated mastery of these shockwave application techniques are prerequisite to the safety and efficacy of medical shockwave treatment.
Let's recap. Focal technique for pinpoint pathology. Global technique for tissue coverage.
5 cardinal applicator movements include: sliding, sometimes referred to as gliding or snaking. Tilting, also called fanning. Rotating. Rocking or waving. Compression.
A coupling gel is required for effective energy transfer between the transducer and the skin. The angle of shockwave delivery should be perpendicular to the skin, not deviating more than 30 degrees to avoid decoupling. To learn more about shockwave, subscribe now, or visit us online for memberships and certification.
This video training has been sponsored in part by the Journal of Shockwave Therapy and by Shockwave Society members like you. Thank you.